out of the two speakers, Anna, she spent 2020 juggling being a data scientist and being a mother to a toddler, which anyone who's had a toddler, has one, knows that's no easy task, full of energy and full of disruption and destruction. All right. And Imane, this is a story back when she was going to be an exchange student in Hong Kong. She kept looking to get a secondhand bike, but she couldn't find one. It wasn't until she moved there that she realized why she couldn't find one. And I'm going to guess the answer is because of all the hills in Hong Kong. Hong Kong is very famous for the hills, which makes for dramatic skylines, and it's awesome, but it makes it very hard to bike. So please welcome to the stage, Anna and Imane.
So hello, thank you very much for giving us the chance to present our work here. I'm Anna Mantsoki, I'm a data scientist here at FIND.
And I am Imane El Idrissi, a junior data scientist also at FIND.
So today we're going to talk to you about our FIND SARS-CoV-2 tracker for our testing data. It has been really unprecedented here, if we might say, because it certainly feels that our world has stopped on its tracks after experiencing this pandemic. Certainly, this is not the first time that the world is experiencing pandemics. There was the Spanish flu, for example, in 1918, but I guess there are not many people here in the audience that they have a first-hand experience on this. But back then, around 1/3 of the world's population actually was infected at the time. But one might argue that there are two key differences right now. Firstly, we actually have a truly global economy where international travel and habits on our getting our food from all over the world would allow COVID-19 to spread much more rapidly. And also, we actually have the tools like modern medicine and data access to be used in sophisticated sort of modeling techniques in order to fight this and allow the countries to track the pandemic. But even though this is a global pandemic, unfortunately, still was tackled in national levels, as we've seen, and sometimes it was heavily politicized, and science was sometimes ignored as well. So since the beginning of the pandemic, the WHO director, Dr. Tedros, who you might be familiar with now, has actually spread the message of test, test, test. But why is testing really important? Testing is actually our main tool in order to combat this pandemic. It can actually help us do contact tracing and isolation of the confirmed cases. It has been actually, preliminary results show that one death of around 1,000 health workers screened can be averted. And actually using the right numbers, it can inform policy decisions. But cases, hospitalizations, and death data, unfortunately, they're easy to obtain, but because they're quite visible. But testing data is not, they are a bit more abstract, and even though they should be used in order to inform the metrics on positivity rates, on infection rates, in order to help us reopen our economies.
So at a very early stage of the pandemic, it became clear to everybody that testing was important, from patients to healthcare workers, including policymakers and governments. However, it was clear that there was no authority taking care of the worldwide testing coverage reporting, and neither guiding all the countries of the world on standards on how to report their testing data. So you've probably seen many of these dashboards describing the global pandemic. And this is just an example of the World Health Organization dashboard. They display many different epidemiological data describing the pandemic. You have like cases and death numbers, but unfortunately the test numbers are missing. This is a global pandemic and we live in a globalized world. Look at us here in Geneva. We basically cross the border between Switzerland and France several times a day without even noticing it. It is really important to be able to have a global overview of the testing coverage for COVID-19. And this was missing, and we really identified a gap here. But fortunately, there are solutions, and we have people believing in those solutions. And this is why Anna and me are here today. So we both work at the Foundation for Innovative New Diagnostics. It is a non-profit organization in global health that was established during the 56th World Health Assembly in 2003. So our mission is to make diagnostics for infectious diseases available everywhere, including for people in low and middle income countries. And in order to achieve that, we partner and we build projects by partnering with the public and private sector. So we work on different diseases, for example, tuberculosis or malaria, and we also work on pandemic preparedness in general. And this is why we got involved in the ACT-A, which means Access to COVID-19 Tools Accelerator. So it is a global collaboration to accelerate the development, production, and equitable access to COVID-19 tools. And there are three pillars: the vaccines pillar, the therapeutics pillar, and of course the diagnostics pillar, which is where FIND intervenes. But in order to properly fulfill our role in the ACT Accelerator, it was important to know how well the countries in the whole world, how well they were doing in terms of the testing coverage. And since that was missing, we tried to investigate country by country. So some countries decided to group their data. For example, we have here the dashboard from the Africa CDC, and they showed a very good example here. So we have epidemiological data on COVID-19 for all the African countries, including the number of tests. Other countries, unfortunately, didn't decide to put together their data, and it almost looked like a competition for the fanciest and the most colorful dashboard. So we have three examples here: Qatar, Switzerland, and Sri Lanka. As you can notice, they report daily numbers for COVID-19 testing, and they report in a precise and structured way. And also we can see that their dashboards are actually in English, although their official languages are not necessarily English. Other countries didn't think of that. So there is clearly great effort put in formulating daily reports describing the national situation about the COVID-19 pandemic. But unfortunately, we can clearly see that the people behind these reports, they didn't think of the accessibility of their data. So it's all Greek to me is basically the sentence I told Anna when I was desperately trying to localize the testing numbers in this PDF, all written in Greek. And fortunately, she is from Greece. And you know, this is quite representative of Geneva and the Foundation for Innovative New Diagnostics, because it is a multicultural environment, and we have people coming from many different countries and speaking so many different languages. And thanks to this great diversity, we were able to basically find all the testing data from the different countries of the world. So at this stage, the data team of FIND decided to build a global tracker for the testing coverage of COVID-19, and Anna will tell you more about the whole story.
Yes, thank you, Imane. So initially, having this very ambitious aim, we tried to show the global picture, and we had to put together a dashboard, like everyone was doing in the beginning of the pandemic, in a very short time. Unfortunately, decisions were not taken that, thinking the outcome, and that picture was taken a long time to load. Some of the problems were that because of the data were scraped manually from each website report, Twitter report, Facebook report, you might imagine. And we were putting lots of time and effort on this every day. Then all the data sets that are used in the Shiny app, they were actually generated by the Shiny app, actually slowing down the application significantly. And then, like countries, sometimes we also didn't think of the end user, and that some users might need to use our data for their projects. So it was not very easy to retrieve them programmatically. And last, it was not very user-friendly from the feedback that we got, because there were too many tabs and users were getting quite lost with all this information. So we decided to actually fix some of the problems, and we developed and designed fetch functions in R in order to parse these websites and reports from the countries that were actually at least reporting it in a place that we could retrieve. And then we actually generated an R package where we put together the generation of the data sets. And we created a GitHub repository where we were pushing every day all the data sets produced. Also, we got an article-like app feeling, and we shaped our application. Imane will go further with the fetch functions.
So, from the diversity in the different ways the countries actually report their data, we found some similarities, and we then grouped them, and we assigned different types to the different groups. So some countries were assigned the type HTML, others the type PDF, and for more complex countries, we decided to use Selenium. So we have a Selenium script that scrapes the data of some countries, and then we generate a text file containing the scraped data. We have our script that goes country by country, and according to the type the country has been assigned, the R script uses what we call fetch functions, and it uses the corresponding fetch function. So for example, if the country has the type HTML, the R script will use the fetch from HTML function, and if it's Selenium, it will be fetched from Selenium, and then read the text file. So we end up every day with a file containing all the testing data, so the cumulative and the new tests per day. And then we put this file, we push it on GitHub. And Anna will explain you how then from GitHub this is actually put in our test tracker.
So as soon as Imane pushes the file on GitHub, this triggers an automated workflow with GitHub Actions that actually executes the three main functions of our package. Which is process JGU data, which is actually a function taking together the cases and deaths data from the Johns Hopkins repository and creates the coronavirus_cases file. Then we have the process test data, which creates the coronavirus_tests.csv, and the create Shiny data, which combines both of these data sets in order to create the data Shiny dataset, which is then used by the Shiny app. All these three datasets are updated daily, and they're found on our FIND COVID-19 tracker data repository on GitHub. Then we actually reshaped the Shiny app. As we said before, we wanted it to be a bit more like to have an article-like feeling, so the user can go through all the different visualizations, etc. I'll show you in a bit. We basically used the tabular-R package in order to enclose the fluid row layout, and we used the e-charts for R functions in order to render our visualizations for the map and the time series. Also, we used a global.r script where we put together all our helper functions in order to read the file from our GitHub repository and filter it in order to be used in the Shiny app. So I will show you very, very fast a sort of preview of our tracker. It's found on it's embedded on our main FIND website. Here you can see that we have the testing coverage we have detailed instructions on how to use the application. The user can actually select the different outcomes, test cases, test positivity rate. There are toggles for daily and cumulative data and per capita and total. So to show you how a user can get a very fast insight on the data, since Imane said before that our mission is to show data, especially if coverage is enough and equitable of testing, we want to show that there is a clear difference of testing coverage between high income and low income countries. You can clearly see it here on the map. In Africa, South America, and Southeast Asia, daily test capacity is far lower than the actual in North America, Europe, etc. And the user can get actual, visualization of this straight away. Here we compare the data by country, continent, or income group. The user can actually sort and choose the different categories that we put together. I will quickly select high income countries and low income countries, which is also an input for our track change over time series graph. It's an HR graph, so you can clearly track the pandemic, and you can see that there is a striking difference between the number of tests performed in high-income countries and low-income countries. So we wanted to get across this message really, really clearly, and then we can have the data downloaded either for the selection that was done above, or the user can actually go through the stable link to our GitHub repository. So now, what are the next steps for us? More and more countries are actually deploying the use of rapid diagnostic tests, which is different from PCR tests, and it's really important to be able to discriminate between those two types of tests. So, because we really want our tracker to respond to what is needed to tackle the pandemic, we want to go and evolve along the pandemic, and we will definitely start soon segregating data between rapid diagnostic tests and PCRs within our tracker. We would also like to include the number of RDTs procured per country, since it is also a very important information. And at this stage, we still have some countries for which the testing data is taken manually, and we obviously would like to automate also for those countries. Probably we will use CLI, Selenium, and GitHub Actions because it's easy to maintain and less resource reliant. So all in all, these tools have actually enabled us to access the data that were very scarce, and they were all over the place, basically, in multiple websites, unlike the case data. So they allowed us to actually have access to these when we had really many constraints of time and resources here in FIND, and we needed to produce a very high standard web application to put out there in our website in order to add value on the importance of the testing data during this pandemic. We would really we would really like to highlight that this testing data, etc., should be really important and should have, you know, their open access sort of repository, no matter if you have an outbreak or pandemic, but in general, in order to sort of inform surveillance and epidemiological efforts, to inform research, and have really evidence-based policy decisions. And also, we need to have orchestrated efforts from governments, other authorities such as ministries of health, etc., to produce this sort of machine-readable data and open access in repositories where researchers can use them, you know, very, very fast. And we would like to help our colleagues here in FIND, Christine, Stefano, and Orna. And of course, we would like to help Patrick and Christophe from Syncra that have helped us reshape our application. And last, Andrew, that helped us put together the slides in order to get across our message better. Thank you very much.
Thank you. Excellent talk. We're continuing along our day, and our next speaker